Yeah, look, we don't address alcohol as far as incorporating it and including it. Obviously, our rec centres is not an issue. Food trucks, same thing. Events, yes, and sporting clubs, yes. So that's a tricky one with sporting clubs. I can't remember if it was you that mentioned, Melissa, that sporting clubs is an issue when it's a fundraiser for them. It's a social thing, particularly, and when you're getting people coming, and it's a revenue raiser for them. So that's something that is sitting with our rec team that they need to address, particularly given we've got this policy now, as in the rec and library policy that specifies and actually flags sporting clubs and so forth. Events is a tricky one, particularly Town Hall. We have so many events there. We have a number of events that are, ticketed. A lot of them are ticketed events, so you've got people paying a lot of money for a ticket. So there's that argument of, if they're an adult, should they be able to decide whether or not they can have a drink or two or whatever. It's on the table. I think it is political. So it is a hard one, and one that we haven't found a solution to yet, but it's one that we continue to talk about. At the moment, we're still picking that low-hanging fruit and doing what we can to address kind of the main kind of food, etc. realm, but obviously promoting that water should obviously be everywhere where any kind of food or drink is sold. So yeah, that's the key at this stage. But if anyone has any other solutions, please let us know.
I do clearly it's a big issue, but I think it's one of another series of issues, and that at some point in the future, obviously, we'd hope that they're all connected. But if we can focus on reducing those sugary soft drinks, especially in those areas with children, is where if we can get that normalisation, then it offers the opportunity of introducing other challenges.
I could just say one more
thing
about that. We have had to make that decision recently what to do about alcohol, and our recreation centres some of them have bars, so mainly for events. So we've decided to not include alcohol as one of the SSBs, and I think alcohol is covered. Well, it's basically in those bars, the whole area is covered when it's just children, attending their sporting activities. And it is covered to a certain extent in the achievement program commitments, so wherever alcohols are provided, healthy drink options have to be provided as well. So that is covering off to a certain extent, but treating them separately.
That's one of the next big debates, I think, too, because it's not just sugary drinks versus water, but there's the debate around bottled water versus tap water, and the additional fluoride injection from tap water. So there's an additional health issue there, and I think it's a debate that's only just beginning, and we're only just starting to turn to water. At a council level, sort of public space amenity is where some of it comes in. What state how easy is it to get to a bubbler, for example, and what state's it in, and would you want to use it when you got there?
And is it working?
And is it working? And I think we haven't looked at our bubblers situation. I think they're mostly from the 70s, aren't they? Whittlesea is looking at purchasing one of these there's big new designed water fountain, doubling up as water into the dog bowl receptacle things. We're looking, they're $3,000 to $5,000 for one. You can put branding art on them, but apparently the design's not great and they fall over and the dogs can't get the water. So it's early days, but we're starting to look at that infrastructure, that urban infrastructure. But clearly it's hard to get water. The community tell us. Very hard to get free tap water. Hard to get bottled water if you want it, unless you make a special request. So we also have, venues are, when they serve alcohol, I think I'm right, also required to provide free water to their customers. Now, people don't necessarily always know that they can go up and ask for free water. So there's a little bit of work that can be done there around things that are already in place but need promoting. That's probably the two things I'd say about it.
Yeah, it's interesting and good question, because it's actually come up. My team does the municipal can everyone hear me? Do I need the mic? Yep, up a loud voice. We do the municipal public health and wellbeing plan as well. So we work with the corporate planning team, and that's integrated in our council plan and is ready to go. Actually, it's ready to go up to councillors. We actually had that question from Vic Health actually that inquired about our available drinking fountains. What are we doing about, is there an initiative as a priority area around making more available, et cetera, et cetera. So we've had to look at that, and we are looking at that. But the good news is, and we didn't know everything. So once we spoke to our infrastructure team, we actually partnered with Vic Health last year and retrofitted 60 potable water drinking fountains and attached them with our infrastructure guys did a retrofit so that they had the refillable drinking option on them. So you could, because not all bubblers, if you've ever seen someone try and fill a bottle with the bubbler, it's just water wastage. So, which we won't go into, but there's that whole other sustainability issue as well, which our food policy covers as well. So we have to be kind of thinking about, yes, water, but also about packaging and cost and all those other things. So that's certainly something that is on our priority list. It's in our MPHP. Whilst there, so we continue in our health plan. Whilst there aren't any planned for this year for a whole nother range of retrofitting or new potable drinking fountains, we are actively promoting about, and we have an ongoing interactive map about where they are, where they're available, where's the nearest one closest to you if you're in Melbourne and so forth. So we will continue to promote that through our heatwave officer and manager. And also that's what I was going to say. Our events, we also ensure that our events team bring in, the trailers with all the bubblers to make sure that they're available around the key kind of gathering areas, so people and families can come and just, their refill stations. So they just sit in a trailer and we just hook them into the water. So that's a key issue, and a good question and one that we're looking at.
Particularly for rural councils, it's really important for us that we go external. We have very limited resources internally, so we've partnered with a lot of our health services, so through the Heart of Corangawan. We also partner with our schools through that network as well, so our health services all have schools which they work with. They run the achievement program through our schools, and we also work with partners such as Deakin, oral health specialists as well. So particularly for us, it's really important that we utilise and maximise those external collaborations. Internally, it's particularly challenging. Rural councils, we don't have income as well, other than our rates. So with rate capping, we've found it particularly important that we need to maximise those collaborations externally, and would welcome anybody that would like to assist the rural councils for sure.
Thank you, Lucy. Can you, thanks for your questions. Can you please thank Lucy, Lainey, Melissa and Rosie?